My name is Kirsten Wengler. I'm a women's health nurse practitioner. I've been a provider for the past 15 years, and I've been with women's care for the past almost 8. I started in labor and delivery as a nurse extern at Wausau Hospital in Wausau, and kind of came on that kind of by accident. Found out that I really enjoyed taking care of healthy women and the newborns and working in labor and delivery, and so I did that and then went on to work at in a labor and delivery department in Green Bay. And then I was interested in working more during the day because, you know, babies are born at all times. And so natural progression was to become a nurse practitioner. And so I went to the University of Wisconsin Women's Health Nurse Practitioner program. I graduated in 2001. My favorite thing about working at women's care is the variety of things that I get to do. So I see patients in the clinic. I do annual exams. I see OB patients. I see problem visits. I see problem OB visits. I get to assist in surgery, so I assist in things like hysterectomies. I've also trained on the Da Vinci robot, and so I'm assisting in those cases. I also assist with C-sections, which is one of my favorite things to do, obviously, when it comes to the new babies and the new moms. I also make hospital rounds, and so in the morning I see the patients that are in the hospital with their new babies, as well as the people who have just had surgery. I do colposcopy, which is a procedure that we do in the case of an abnormal pap smear. And so it's a wide variety. I never do the same thing every day, all day. It keeps things very interesting, and it makes me like all of the pieces because I never do anything too much. I really enjoy young people. I enjoy the first pelvic exam. I work really hard to make people feel as comfortable as I possibly can in a situation maybe that isn't the most comfortable, especially somebody who's new to the gynecologist office. And so I like talking about sexually transmitted infections and preventing them. I like talking about screening and the guidelines that go along with screening. I like OB visits. I enjoy the pregnancy visits, and I also really enjoy doing pre-op physicals. Those are probably my most favorite visits. My parents still live in Wisconsin. I have a sister who lives nearby. My husband's family lives nearby. We've known each other since the 4th grade, so we've been friends for a long time. And then we have the 3 golden retrievers, 2 puppies, and almost 10-year-old next week, Britt, Stella, and Sarah. Well, my husband and I are really interested in golden retrievers. I've had one ever since I was little. And so we're members of the Golden Retriever Rescue of Wisconsin, and so we do fundraising activities with them. We're also involved with the animal shelter in Neenah and partake in the events that they have, with our favorite being Drool in the Pool, which happens in August, where they open up the city pool the last day for the dogs. It is my favorite day of the year. I always take it off a year in advance, and we count down to it. Even if you don't have a dog to go to that event, you cannot walk away from there not feeling totally happy, because they dump about 200 tennis balls in the pool, and the dogs just play and swim, and some of them even go off the diving board, and it's a really fun event and a great fundraiser for the animal shelter.